Today I want you to listen to this. If you are young nurses who are soon to graduate, you need to watch this video. If you're also a soon to graduate in any other profession, you can also learn from this. Now, let's assume today is 2011 and I was halfway through to my nursing education. One day I sat myself down. If I graduate, where am I going to work? Who are my employers? If government job did not come, which obviously, because I was a single qualified, it's very difficult to get a job with the government. I already knew that I won't be getting a government job. Which obviously, today, many people expect that government job would be what they want. It's easy to get a government job as it seems as a student, because everybody they know are doing government job. But in many cases, these are not the same. These are not what turns out to play. And this result to confusion, frustration, and then we begin to call government many names, and then we forget one critical question. This is what I did in 2011. I sat myself down and I said, where will I get a job? Who are my employers? Who will employ a young graduate to work in his firm? I sat myself down and I said it's going to be a nursing and maternity home scattered around Benin City. And then, or I could also get a job in the medical centers, which is also, at the time, we were employing few nurses as well. But the majority of those who will employ me as a male nurse were people who own nursing and maternity. This is what I found out. Nobody taught me. I sat down and I come up with that belief. And that is what I want you to learn today, and then see how you can model this and implement in your life as you graduate. When I come up with that, then I ask myself the next question: what skill would they need from me? Or what skill will I need to possess to make me a very good candidate for the job? I tell you, that is what I found out. That is what I resolved. I ask myself those questions, then I come up. Mind you, at this time, I have never visited any private nursing and maternity home for any reason, even to visit people, any of my friends who could be sick. But I come up with that feeling, an understanding of human nature and the environment that you live in, and your nature of job, nature of training, and where possibly you could get a job. So I then said, okay, if these are the skills, because I already listed the skills, which I will list now. Number one, you should be able to suture wound. You should be able to take delivery. You should be able to examine, monitor women in labor. You should be able to diagnose, nursing diagnosis, impression. You should be able to have an impression of a case, a complaint. You should be able to have an idea of where it's going. You should be able to do something to stabilize the patient, and then you can then refer or bring in a consultant or bring in somebody who are more expert to review the patient. These are what. Then I said, okay, how do I get this information? How do I get this hands-on experience? Then I remember I met with a CEO of a nursing and maternity home here in Opasa, Mumbai, where I told him, these are what I want. I want to be coming to learn from you, practical experience. Although we are posted to hospital, but there's a specific things I need to learn, which is monitored pregnancy, monitored labor, and then take deliveries, do suturing, be able to consult and know what could be wrong with patient when they do complain. Oh, he said, all right, you can be coming. Fantastic. He was impressed that, oh, someone can sit down and be able to put himself into good use for his future. I resumed that work. You may ask, are you not getting those training while you are as a student, while you're in school? Yes, but it's minimal. You are posted to O&G for 3 weeks, and you don't get to monitor or take delivery within those time. You only wash, you do errands, you run around to make sure everything's in the place. Of course, you know what it is. You are sent to ED to see what they are doing. It's too busy, it's too fast-paced for you as a student to be able to put yourself into learning and gaining information. You are just there for momentarily. It's not like you settle down to say, okay, Their suture. Nobody is telling you why they are using this type of suture, the size, why they are using this type of suturing techniques. You're not going to get all of that, because the moment one is leaving, another one is coming. That's how you do it. You close, you go home, you are tired. But when you do it as in a learning stage, the person who is doing it with you, who is doing it as you are watching, knows that you are there to learn, is able to put you through, is able to give you hands-on experience, which I recommend. I did all of this, and I continue to learn. Before I graduated 2013, I already have the experience I need to be employable. I was not just a new nurse, but I already have basic experience of what an employer will need. I graduated October. Between October and December, I've shared my CV everywhere, detailing my experience, what I can do. You know what it is. You know how to apply for a job. It's not the conventional CV curating type. This one, you are telling the story of what you have gone through to master certain skills, which you found that they will need. And that's the reason you are going to be employed. You understand? So I got a call and I did the interview. He asked some fundamental training experience question that somebody who have really done this should be able to know this. Not theoretically. You know, when you do, let's say somebody asking you what are stages of labor, theoretically you know what it is. But can you differentiate between a woman who presents with an active phase of labor and a latent phase of labor in terms of doing VE, checking BP, checking contraction rates and time and all of that? Be able to monitor heart rate of a baby, know when you need to call for help. And then you are not only calling for help at a certain time, you know what to do if this happens. If a child heart rate is over 150, for instance, you should know, what next should I do? Let me put up an IV fluid. Let me put up an oxygen, because it's already tachycardia. If it's low, you know what to do. I'm checking blood pressure. If the blood pressure is high and you just starting an active phase, what can you do to stabilize the patient? How do you calculate drug dosage in terms of weight, in terms of what is required? All these are hands-on experience that you need to be able to be employable. Why I'm telling you this may be how much are they paying, but still, you just graduated and you already have a job. Do you know the pride that comes with that kind of a mental state, that you graduated, you are not lying fallow around, you are getting ready, you're going to work. Your family will be proud of you. You'll be proud of yourself, and then you will just calm your nerve down to focus on your future. Focusing on your future is important. That's why you are starting early to plan, prepare, and then move forward. You are not dilly-dallying. You are not trying many things. You just know, this is when I finish, I need a job. What will I do to be employable immediately I graduated? That is what you should focus on. Once you now get the job, no matter how small it is, you now say, okay, what do I need to do now to move to the next level? Level by level. You understand? This level you are now, you are planning to become employable. I beg you, this is what you need to start doing. Then, in terms of getting the practical experience, I also think about, why don't I have theoretical experience, which is not taught in school? That's why I said the school is already programmed to make you employable according to theoretical framework that is already designed for the school. But it does not work for everybody. That is why people will say school is a scam, which I strongly disagree. You don't seem to know what you need to be able to jump the ladder or the scale. Or you think all the information given to you applies to everybody. No. It applies theoretically to the subject, to nursing. It does not apply to everybody who is doing nursing. Some people graduate and then they are candidates for employment immediately. Why are they being employed? It's because they have extra leverage, and one of them is you preparing yourself practically. Not everybody will do government job after all, and not everybody who apply for government job, even if they are qualified, will get the job. Will you now come home and sit down, lying fallow, jobless? No. And this also applies to all other professions. I have friends then who who were in school already, who were in school, what they were planning to write ICANN exam. Some were writing what they call it, these HSC exams. So we're doing BLS, ALS, ILS to be able to have leverage to be employable. That is what we're talking about. The next thing I did was I bought books on midwifery. I bought books on applied physiology. It was clinical physiology. In that book, you will see medical problem and signs and symptoms, investigation to be done, and what possibly will the patient be feeling. That signs and symptoms. We're talking about investigation, then queried impression, what you think could be wrong with this patient. You differentiate. The book will help you to differentiate different type of medical problem that are related. Like if you're having cough signifies a lot of things. If it's not upper respiratory infection, it's lower respiratory infection, it's congestive cardiac failure. Not all congestive cardiac failure will come up with pedal edema. Coughing at night and not coughing during the day is most likely going to be congestive cardiac failure, which if you don't know, you don't know. And I bought the book, I began to read it. Any of my classmates who is watching this video will tell you, can testify that when we were in school, I had other textbooks that were not related, that were not prescribed for us to buy, but I had it because I was planning to get into the job market, because I know my background, where I came from, and I cannot afford to graduate and sit at home lying fallow, no job. And a lot of people will not get job in the first 2 years. It's not a course, it's how it is. But a lot of us got job immediately we graduated. It took me less than 2 months to get my first job. And when I got to the interview, the woman already knew that I have the experience. I was able to show that I know this, I know that, and I can put it all together. I can manage patients with diabetes. I know how to calculate dosage, how to monitor, what to look out for, what to check, what kind of investigation to be done, and what kind of treatment they need. Then I bought tropical diseases textbook. Those are my 3 major textbooks. I bought extra to be able to know, because there are a lot of diseases. For instance, a patient comes urinating blood. Sometimes if you are shallow, you'll be thinking of kidney failure, let's go and do kidney function test. If it comes back good, what do you think? But do you know that it could be an infectious disease gotten from the river? You know all of that. Sometimes a patient can come with urinating dark urine. If you are shallow in knowledge, you think, oh, it's kidney. Immediately you mention that to the patient, you have broke his heart. A patient can leave you without money, without paying. And if he goes somewhere and got a right diagnosis for what is really wrong, you have lost a lifetime client. But if you get it right, you are winning a client forever, which for black water fever can come up with a very dark urine. So that's why I bought the book. And this come up with the cases I was seeing and the differential diagnosis the doctors and the clinicians were giving, gave me this idea that, okay, I need to know theoretically, deep down, midwifery. I need to know clinical physiology so that I'll be able to know diseases and how they present. I'll be able, you know why I'm preparing? Because as a male nurse, nobody is going to employ a male nurse. It's going to be difficult, sorry to say. It's going to be difficult as a male nurse to get employed in a place where they need female nurse. Female nurses are more likely to be employed compared to male nurses. And if there's a job vacancy for 20 roles, I can tell you 18 will go for female and 2 will be male. And they will employ those male so that it doesn't look like. That is why as a male, you already know what the market says. You may not know. Because I was already thinking of the future, I already be able to know how many male nurses are getting jobs. Either working in government or working, what are they doing? Because I know a lot of my friends, my seniors who graduated, they were male, they were all trying to get it, but the female were getting job in Central Hospital, in UBTH, in this private hospital, employing them life right center. But the male were trying. It's not that they don't know what they're doing, but this is the dynamics of nursing, because nursing primarily from the inception are feminine. So it's still applicable. You may say, oh, this is the, but this is what it is. So as a male especially, you begin to think different from the boss. How do I make myself employable, attractive to employers, so that immediately I graduated, I won't have to be hustling for job? So I got this on. I begin to study. I begin to see what I'm studying in real life. I begin to be able to discuss, converse in terms of the professionalism when it's on the table. And people will think, where is he getting this knowledge from? I'm not saying this to brag, but it is what it is. You have to prepare for the market. The preparation I prepare for after graduation to get to it's not the same preparation I prepare to come to the UK. Coming to the UK is another episode on it. I will tell you the kind of preparation, because here you're going to do total nursing care. It's different from what that first preparation, this one I'm talking about. I got prepared to get the job, because we were going to be seeing patients. Most of us, I know a lot of us who graduated, immediately graduated, they told their families, I'm not looking for a job, I need money to establish. They went straight to establishing nursing and maternity home. In less than 3 years, 2 years, they've finished registration and all of that. And that was it. And some of us, like me, I know I don't have anybody to raise money for me. I need to get a job. My first job was to manage a nursing maternity home. The woman who owns it, or for government, is always away Monday to Friday, come weekend. So I manage Monday to Friday, and she do the weekend when she's around. In fact, if she has a complicated, she still call me in to help her. It come with an extra fee. I was managing the place. I will be there as full time. If I have patient at night, I will still be there to get the job done. That's why in my other post, I said not be hardworking. I'm not saying push trucks. What it means to be hardworking is making sure the job is done, making sure that results is what you need. The results. It's not about, oh, we have admitted him and I've closed. Then you left. You left the place. Nobody to continue, and you know that the person on ground is not capable. You leave. That may be your modern hard working, but when we are on, if they leave it something for you, you will take it as a responsibility to make sure it's properly done. Why I was doing that, I was doing some practical in the same place, reading, measuring it up with hands-on learning and all of that. I was still able to get to class, do their own practical where we will be posted to hospitals, still be able to read the book. I was still getting, and the beautiful thing is, I still pray that the gentleman receive good deeds, goodwill from all his good deeds. He called me month end, after the first month end. He called me. He gave me 6,000. He said, I'm not going to put you on a salary, but anyhow the month behaves, I will be giving you something to support you. As at that time, 6,000 was a big money. Although it was small because all other people were receiving 20-something thousand, 30,000. But for me, 6K was big, because I pay rent. At that time, I was paying rent 1,500. So if I pay rent, I still have some money I was able to buy more books. I was able to buy clothes. We were able to do 1 or 2. From there, I was also getting clients from somewhere. Oh, this person, he has diabetic foot. He's been discharged. They will contract me, come and be doing dressing. We'll negotiate price. That is how the hustle started before I graduated. So if you are in the verge of graduating, or you are planning graduate, you will need to watch the video completely and then make up your mind what you need to do, what you want your life to look like when you graduate. By doing so, you will start planning, not prayer. You start planning. What do I need to have to be able to be valuable in the job market? The funny thing is, Nursing is like every other profession. Forget what you are told. There are people who are looking for a job, they don't have it. There are people who are jobless. There are people who are job hunting. There are people who are losing their jobs. Same way people in accounting, people in medicine, people in laboratory science, people in radiology, ophthalmology, marketing, banking and finance. It's the same job reality, because we all live in the same environment. If the road is bad, it's bad for everybody. If there's no light, it's no light for everybody. There's no difference with the reality of the job market. If you are an accountant, you are reading accounting, you should plan. Should I have an account before I graduate? Will I need an account? Will I become a chartered accountant? Will that help me? If you are reading laboratory science, you should know that you need hands-on experience to be able to get the job done. So are you planning in getting those experience so that when you graduate, you are already ready for the job market? These are important conversation you need to have with yourself and decide. No icky packing. When I was in school, I was doing tailoring to pay my school fees, to take care of myself, pay rent, do all of that. When I finished, I packed the machine. Oh, are you no longer sewing? I said, no, it's part-time. When I was trying to get admissions, I was learning computer. When I finished, I was using the computer to work. Immediately I got the admission, I was using the computer to work. Immediately I finished that school, I stopped using computer to hustle. So if you're making plans and you devise a means to get to your dreamland, don't let what you are getting from here prevent you from moving on with your plan. I'm in the UK, it would be easy for me to say, let me buy a sewing machine and be making clothes. At least I will see one or two. It will distract. It's a distraction. In my own understanding, my wife will say, oh, buy a machine. I say it will distract me, because there are a lot of things that I could actually achieve more without having to, because the energy, because the way I do math is, if I focus on it, I get it done to the best of my ability. I'm not going to deviate, look here. If I'm making clothes, I try to make it the best I can make it, and that requires dedication. I won't have time to be reading, because I need to read a lot of books. My books, I have a lot of books that are waiting for me to read. I'm still doing some courses that I need to study, and then I have work, I do extra job, they call it bank, so money work. That is one thing I want you to, don't let those things that help you to get start of your dream become, oh, I need to drag it along. No, you are dragging unnecessary load. Focus. You do everything. Some people sell pure water, some people do a lot of business to see themselves through school. Make sure you focus on getting your dream going. You will now have a job. That's the next topic. You graduated now. You have done all of this. You get a job. What next? Focus. No matter how small, how big the salary is, just calm down and focus. Do I need to get a degree now? Do I need to get double qualified now? What should I be doing? As I'm getting little money now, I take care of myself, do all of this. I don't need to leave my parents' house, or I don't need to leave one room now. I need to manage, save money, do your degree, or is it degree, do your post-basic, so that I can get a better job. When you now get to that job, you have finished this preparation, you are now done it, you are now gotten the job. Calm down again and focus. Where do I need to go now? That is how to think progressively without having to drag excess load along. These are the system and step I use to make sure I keep building on top what I have built, and without regrets. As a nurse, one thing you must zero your mind on: if you lose it all now, you can build it again, because you have built a system for yourself that you have used part-time. if this is what I need to do at this time, what I need to have at this time, this is my target, what do I need to do? And then continue on that plan. Don't let any distraction get in. Adjust this along the way, but focus. Continue going. Get it? I said, do anything that is necessary part time to get your dream correct. But don't let that become an excess luggage you carried along when you get to your new destination. The same way, I finished school, I got a job. It's a new place. I focus. What do I need to do? I need to save some money. I need to get to Lagos. I moved to Lagos. The pay was good. The environment was nice. Everything was. I slowed down. I focus. Do I need to travel now? Do I need to go abroad? Do I need to raise a family? I decide and I focus on it. I already have plan written down. Nobody. The other secrets, I won't tell you now. That is left for people who will come as a mentee. Let me give them the inner secret to getting this going. You get it? Those are the inner teachings of the deep things to getting it done. But I'm just telling you, you must be focused on your dream. And once you get to step one, slow down, be calm, focus. Don't carry excess luggage. Don't carry one excess luggage. Just one. Do not carry even one along. Focus on your dream. As I got to the UK, I calmed down. I focus. What do I need to do first now? What do I? People were telling me, bring your children immediately. No. I said, no. I calm down. I visualize. But that's a topic for another day. But let's continue. You will say that when you have plan as a newly graduate nurse or a professional, or you are nearing your graduation, it's easy for you to see the bigger picture. You graduate, you enter job market, you know where you are looking to. Don't exaggerate, don't overprice, don't be, oh no, it's government job. You know you have single qualified, you just finish, you know you don't have a degree, you are looking for government job. You know it's difficult to get a government job at that level. You know it's difficult for a big company, a big hospital to employ you while applying there. So what I did was I focused on the small one that will see me as raw talent, and then I can grow that talent. You get it? That is what you should think about. Where will I go that they will see me as a raw talent that needs sharpening, so that I'll be able to learn and apply knowledge, and you will be able to diversify things. You will have time to do post basic, you have time to do your degree, you have time to study, to plan and prepare to get a higher job. You have time to think, should I open my own with the way it is now? Do I know the business enough to say, okay, let me open a nursing maternity and continue from there? When you combine this knowledge, you will see that while everybody is looking depressed, looking morose, as we may say it, you look with optimism because you already know where. While people were going to Victoria Island, when I got to Lagos, a lot of my friends were going to up Lagos, Lekki, Victoria Island. I was going to Ketu, Ojota, Ijanokpaja to look for a job. In less than 2 weeks of getting to Lagos, I got a job because I know where my talent will be required easily. Not that they don't require it in those big hospitals, but this place will give you time, rooms to learn, rooms to really get your things in order, get your art, and will afford you respect and some leverage. You can leverage on those relationships and then begin to now build your life. So why people are saying, oh, we finish, we need a government job, but somebody is taking a smaller job and is learning and is building. while some people are still roaming around. It is planning and knowing where you can fit in part-time. I can tell you, if everybody apply for a government job, all qualified, they won't take all. If everybody apply for a private hospital, all qualified, they are not going to take all of them. There will still be people that are left. And the most likely people that are left are people that should be managing, not say maternity, managing hospitals, not worker like everybody. I can tell you, go and check. The likelihood of not getting the job is that your interviewer your interviewer will see that you have a trait of a manager, not as an employee. That's the likelihood of not being employed in the Nigeria of today. So if you have that character of being able to manage things, put your life in order, manage, you are likely not going to get the job in that big hospital, but you are likely going to get that job in a small hospital who needs somebody to manage things. That is why I'm saying, use your upper, use your brain when you are looking for a job. You get to, let's examine, for instance, you get to Benin City, you want to look for a job. If you are a young nurse, you just graduated, the likelihood of getting a job in Upper Mumbai is more than getting a job in GROA. The GROA pay better, and is flamboyant, but you are unlikely going to get that job from there. But you are likely going to get the job down Saple Road, down Upper Mumbai, than to get it in GROA, even when both of you are qualified. But you guess what? In a week, somebody who is looking for a job in Upper Mumbai and down Saple Road will get the job. But somebody who is looking for a job in GROA in 3 months will not get the job, even if he's qualified. That is why I'm saying, when you come out into the job market, you must understand what you have, know who needs it, and go to those areas. The strategies I was using to look for job those days when I dealt to Lagos, because I don't know anywhere. I will look. Once I stand on the road, I want to decide which side to go. Where are traffic going? Anywhere the vehicle, if I see more vehicle in the morning, I wake up in the morning, I see all vehicle going this way. You know Lagos the way it is. All vehicle going this way, and this side is empty. It means I'm going this side. The side that is empty, where the traffic is empty, I will go that side, because I know that small hospital, small clinic and maternity, small nursing and maternity are going to be in the residential area. It already shows that side where people are coming from is residential. Where people are going is commercial. You are not going to get the kind of job that I was looking for in the commercial area, but I will get it in the residential area. So this side is residential. You can also flip it. You want to understand in the evening. This is 5, 6 o'clock, 7. You want to know which side is commercial. Look at the traffic again. You see that everybody is heading this way. It means this is home, and this is where commercial. So you already know that where people live is where likely small clinic, small hospital going to be resident. Now you cannot decide to sit down. If this hospital is 4-bedroom, 3-bedroom kind of hospital, nursing and maternity or medical center, what kind of job talent do they need? Your talent should be practical skills in terms of nursing, computer skills, able to manage things, not managing and glove. I'm saying able to organize the facility when the owner is not there, able to get to work, able to make sure you work under supervision. Those are the skills you should be building. And when you build those skills, you will see that you will be ready for the job market. And anywhere you post your CV, they'll definitely call you. When I was doing my CV, I want you to also use this method. I did not do my CV conventional way of doing CV. I do it in a way whereby when you read it, you know that this person have experience that I need, and you will give me a call to come for interview. not the way we are doing CVs now. I will explain some. I usually use some diseases, some health care management to explain that, oh, a patient who is having this and this and this, I manage this type of patient, and this is what I did, this is what I did, this is what I did for the patient, and the patient it was okay. I will put all of that on my CV, so that when you go through it, you know that, okay, because I don't, the way we do CV now was not the way I was doing my own. My own was actually to tell a story that if I'm not there, when you read it, you know that, oh, this one, it has something, you know, without having to remember that this is not the conventional way of doing CVs. That was how I was able to penetrate the market. That I can wake up in the morning and say, in the next 1 week, I will get a job. Of course, you know, UK is different from Nigeria. That's why I said, when you are planning, even state by state are different. It's not the method you use in Edo you are going to use in Kogi, Ondo, Ogun. A different method. You need to study your geography, study your environment, and know what they requires from you. You apply to some hospital, they want you to be nurse, to do total nursing care. You apply to some hospitals, they want you to be assistant to the medical doctor. I've also worked as that, assistance to the medical doctor. When the medical doctor have seen the patient, have admitted, your own is to continue the care of that patient. You are not only doing nursing job, you are also making some decisions in which you also need to, chief, this is what the patient is presenting with. I have done this, I've done that. What else can I add to it? You get it? That is how you prepare for the job market as a young graduate or as a young nurse at home. Keep grinding. My name is Osawaro.